Hi, I'm Dr. Chris Hoppe, and together with my wife Jennifer, we own and operate Cypress Creek Family Dentistry.
What makes our office different from other dental offices is how we do it.
We take the time to listen to our patients and answer their questions. We try very hard to provide them with long-lasting results, whether you're young or old. We have a great location right here in Cedar Park. We have a great staff, and most of all, we have great patients.
We treat our patients the way we would want to be treated.
Why bring your family to CCFD? It's how we do it. Come on in, call us on the phone, or visit us online at www.drhoppyccfd.com.
I'm Dr. Jennifer Hoppe, and I'm a pediatric dentist, and I specialize in seeing children only, and we try really hard to make the children comfortable and have a really good dental experience. We have a waiting room that's catered towards children. We have toys and books and TVs in the operatories so that they can watch TV while they get their teeth cleaned. Our staff is very good with children, and we just try to be very patient and understanding with the kids. It's very important for parents to understand that it's important for them to bring their children into the dentist at a young age to prevent any problems that might affect their permanent teeth or how their permanent teeth will grow in, and to get them started on the right track where they'll enjoy coming to the dentist even as adults. Being a mother of 7 children, I understand what the children need when they come to the dentist, not just from a dentist perspective, but also from a mother's perspective. And I think that it helps me be more patient and to help the children through their appointments.
Hi, my name is Larry Sawinski, and I've been coming to see Dr. Hoppe since he opened his practice here in Cedar Park in 2002. Well, for me, I'm a great people person, and he has a great personality and a way of relaxing me, and as I walk through the office sometimes I see him working with other patients, and they seem to be very relaxed also. The atmosphere in the office is also one that you feel welcome in, and you feel very comfortable being here. It's a great place to come. He's very caring. He gives you a lot of time explaining things to you. If you have questions, he's always there to answer your questions. He's never in a hurry. He always takes his time, makes sure that he's very detailed, and he always makes sure that you're feeling okay before you leave the office. And some of his staff members, especially the assistants that help him in the rooms, always do the same thing. They just make sure that you're feeling okay. And he's very good at giving you instructions and what to do and how to follow up and what to look for.
My name is Terry Randall, and I've been a patient here since the summer of 2003. What really works for me personally is that Dr. Hoppe has a great sense of humor, and his staff is very willing to engage and make themselves known and available to the patients, to myself. And so I feel like I have a great rapport and relationship, almost to the extent that the dentistry is a secondary issue. The other thing that I would like to say is my youngest son has Down syndrome, and Dr. Jennifer is the pediatric dentist here in the office, and she sees, as I said, all of my children, but the fact that my youngest son, who is 9, and has some difficulty communicating and understanding. We never feel uncomfortable here. I feel like everyone in this office appreciates that he's a patient just like they appreciate me or any other patient, that we are all very welcome and comfortable here in the office.
We are unique. We see children, we see adults, and you know, just from personal experience, you know, I'm a bad patient. And so I really reach out to my patients. I listen to them. I try and make it halfway bearable. You know, I think we do a really good job never rushing, taking our time, making people feel as comfortable as we can. And I think that's unique. I mean, that's when we say it's how we do it, that's what we really mean. We're going to do our very best and take the time to do it right and take good care of our patients. You know, we do try and offer a full palette of services. You know, we see children. I see adults up till, you know, 95, whatever age. We have a specialist who comes. He does specialized work on people's gums. We do implants where people are missing teeth. We remove teeth. We do root canals, which is where you have severe pain. We do basic fillings, basic cleanings, cosmetics. I mean, if you can think of it, we do it. You know, we have a great location right here in the neighborhood. You know, we have the ability for busy families to come, the kids can get seen, mom and dad can get seen, cleanings together before the school time comes in August. We do a great job getting kids in. At Christmas time, they come in, they get wisdom teeth pulled, teenagers who are busy. It just really works having, a kid specialist and a general dentist together. And now on Wednesdays we have a gum specialist who's joined us, and it really helps us offer everything that busy families in this area really need. I think location is important. I don't like to have to drive any further than I have to, and we're right in the middle of the neighborhood, centrally located, and it's not just for Cedar Park. I feel like we're centrally located for a lot of folks, and they come here from outlying areas, Georgetown and Round Rock, Marble Falls, Lago Vista, Lakeway. A lot of these patients, want to use their insurance. We accept many different types of insurance. They can come here, they can have their work done, especially for the folks here in Cedar Park. We're right next to Elizabeth Milburn Park. It's an easy place to find. We're right off Cypress Creek Road. It's an easy place to get to. We certainly thought about that when we opened this office in 2002. I try and be very conservative in my approach. I think that we get a lot of second opinions. I think we get a lot of word-of-mouth referrals from people who come here and are very happy. Yeah, that we listened, and yeah, that we were compassionate, but also that they only got what they needed. And I think that for some reason that can be a real problem in our profession. Patients go in, they're faced with an overwhelming amount of treatment, and we really break it down and we really try and focus on what needs to be done. And if it ain't broke, we're not going to fix it.